Welcome to the Prostate Health Channel. If you're new here, we're glad you've joined us. This is your go-to space to explore real, evidence-informed discussions about intimate health, body confidence, and how both men and women can safely navigate choices around sexual satisfaction and genital aesthetics. In today's video, we're going to dive into a fascinating and often controversial conversation: girth versus length, cosmetic genital enhancements, and how these decisions can impact intimacy, confidence, and overall well-being. Let's start with the topic of penis size, particularly girth versus length. While it might sound like a simple comparison, it's more nuanced than many people think. A study that asked heterosexual women about their preference between penile length and girth found that about 90% said girth was more important. This study only involved 50 participants, so it wasn't massive, but the findings align with what we know anatomically. The most sensitive areas of the vagina, where nerve endings are densely packed, are located in the first two-thirds. In addition, the clitoris, which plays a critical role in most female orgasms, can be stimulated through pressure against the vaginal wall, something a thicker penis is more likely to do, so it's not surprising that more women found girth to be more pleasurable. Now, not all women respond the same. Some do enjoy deeper or cervical stimulation, and for them, length might matter more. But research and anecdotal evidence alike suggest that stimulation of the clitoris and the vaginal walls close to the entrance tends to be more important for pleasure. This is why, for example, some partners report improved satisfaction after their partner undergoes girth enhancement, using fillers like hyaluronic acid. Speaking of which, let's talk about these enhancements. Penile fillers using hyaluronic acid have grown in popularity because they offer a non-surgical way to increase girth. When done properly by a trained professional, the results are natural feeling and reversible. Patients, and their partners, often report increased pleasure and satisfaction. However, it's important to note that more isn't always better. In fact, some professionals have had to tell patients to stop requesting additional volume because their partners were already more than satisfied, sometimes even urging them to get more when it was no longer necessary. There's also a physiological limit. For example, in penile reconstruction procedures for transgender patients, when the neophallus is made too girthy, it can actually cause discomfort or prevent penetration altogether. This realization led surgeons to revisit the anatomy and find what works best, not only for appearance but for function and mutual pleasure. That brings us to another topic: cosmetic gynecology. While conversations about penis size are common, discussions about the vulva and its appearance are just starting to become normalized. Labiaplasty, for example, is one of the most frequently performed cosmetic genital surgeries for women. It involves reshaping the labia minora, the inner lips of the vulva. This can be done for purely aesthetic reasons or to relieve physical discomfort caused by elongated or asymmetrical labia. There's a common misconception that all labiaplasties are about fitting into unrealistic beauty standards, but many women choose this procedure to reduce irritation during intercourse or while wearing tight clothing. Others simply want their vulva to appear more balanced or aligned with their own vision of beauty. And yes, it's okay to make personal choices about your body, especially when done safely and with full knowledge of the risks and benefits. Aside from trimming, there are procedures to add volume, like the labial puff, where fillers or even fat transfers are used to plump the labia majora. This is somewhat similar to penile enhancement, except in this case it actually makes more anatomical sense. The labia majora naturally contain fat, so adding more doesn't conflict with the body's structure. Fat transfer involves liposuctioning fat from one area of the body and injecting it into the labia. Though some of the fat gets reabsorbed over time, many patients still appreciate the long-lasting results. Interestingly, while fat transfer is common for the labia, it's generally not recommended for the penis. Unlike the labia, the penis doesn't have subcutaneous fat, so injecting fat there can lead to unnatural results, including a soft or lumpy texture during erection. That's why fillers like hyaluronic acid are preferred. They integrate well with the surrounding tissue and maintain a more natural look and feel. Now let's touch on another trending topic: the G-zone. Some refer to it as the G-spot, but anatomically it's more accurate to describe it as a zone rather than a specific point. This area is located on the anterior vaginal wall, a few centimeters inside, and it includes a convergence of sensitive tissues like the clitoral bulbs and the urethral sponge. Though not every woman experiences intense stimulation in this area, many do, and that's where G-zone enhancement comes into play. Using hyaluronic acid fillers or platelet-rich plasma, PRP, this area can be enhanced to increase sensitivity. PRP in particular involves taking a patient's blood, spinning it to isolate growth factor-rich plasma, and injecting it into the G-zone or clitoris. Many patients report heightened sensitivity and more intense orgasms, although clinical research on this is still limited. Anecdotally, some people, including practitioners themselves, have tried PRP injections and reported a positive experience. For example, one provider shared that after trying PRP in the clitoral area, she experienced stronger and faster orgasms. While that's not a guarantee for everyone, it does show potential. Still, we always emphasize that patients must be well informed about the risks, variability in outcomes, and the importance of choosing a trained professional. At the end of the day, the decision to enhance your genitals, whether for function, confidence, or pleasure, is deeply personal. And it's not about conforming to someone else's idea of beauty or sexuality. It's about feeling empowered in your own skin and choosing what's right for your body. If you found this video helpful or enlightening, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe to our channel. Here at Saúde da Próstata, we're committed to bringing you accurate, respectful, and thoughtful content about all aspects of intimate health. Stay tuned for more insights in our upcoming videos. And remember, your health is your power.